Okay, so, you've probably seen all these headlines about HHS, right?
Yeah.
And all this like restructuring and stuff.
Big changes, yeah.
Yeah. So today, we thought we'd dive into that.
Definitely. Yeah, I think a lot of people are wondering, what does this mean for public health, you know?
Right, and we've been reading a bunch of these articles and press releases,
Yeah.
and yeah,
There's a lot to unpack.
yeah. So what are we trying to do here today?
So I think our goal is to, take all this information,
Mhm.
all this jargon, and like really boil it down to what matters most
Right.
for everyday people.
Yeah.
What is really going on, how big are these changes, and how it's going to affect people.
Yeah. So to give you a sense of the scale of what we're talking about, HHS is going from like 28 divisions down to 15.
Yeah, that's huge.
Yeah, and then they're also they're going to have a way smaller workforce.
Yeah, like a lot smaller.
From 82,000 to 62,000.
That's like a 20,000 person reduction.
That's wild.
Yeah, and that's not even counting, the people who left voluntarily or
Right. There were like 10,000 voluntary departures and then around 5,200 probationary employees who.
right, just let go.
Yeah.
So
Yeah.
big changes.
Yeah. So, and then, the guy who's behind all this is.
Secretary Robert F. Kennedy Jr.
Yeah. And what are his main goals here?
So he's said that, he wants to streamline the agency. He thinks it's too complex, too many moving parts.
Right.
And he wants to save money, taxpayers' money.
Yeah. Like how much money?
They're projecting like $1.8 billion annually in savings.
Wow. That's a lot.
Yeah, it is.
Yeah.
But it's not just about saving money. He's also talking about shifting the focus
Right.
of HHS to preventing chronic diseases.
And that's like by addressing things like safe food, clean water, environmental toxins, like.
Exactly.
Yeah.
Yeah, all those things that contribute to chronic diseases.
Yeah, that makes sense.
Yeah.
So, okay, so like why is this happening? Like why all these changes now?
Well, a lot of people are saying it's about efficiency. They're talking about eliminating redundant units.
Right. Like what does that mean? Like.
So basically they're saying that within those 28 divisions, there are like a lot of overlapping functions.
Right.
And that they can streamline things by centralizing some of these core functions.
So like what kind of functions are we talking about?
Things like HRIT procurement. The stuff that every agency needs.
Right.
Also like external affairs policy.
Right.
Like all those things.
Oh.
They want to centralize those.
So it's almost like, decluttering on a massive scale.
Exactly.
Yeah.
Yeah, like getting rid of the unnecessary stuff so they can focus on what really matters.
Right. And they're saying that will make them more efficient at addressing these chronic disease issues.
Right. That's the argument. And, Secretary Kennedy has said, he wants to create a more responsive agency.
Right.
One that can do more with less.
Right.
And it's interesting because even in their press release, HHS mentions that this restructuring is, in line with President Trump's executive order on government efficiency.
Oh, so this is like a part of a bigger thing.
Yeah, it seems like there's a broader push for making government more efficient.
Right. Okay, so less divisions, more centralized control, strong focus on chronic disease. Like, what does this new HHS actually look like?
Yeah, so there's a lot of changes to the organizational structure,
Right.
but one of the biggest ones is the creation of this new entity called the Administration for a Healthy America.
Okay, what is that like?
They're calling it AHA.
AHA.
And it's basically a combination of several existing agencies all under one roof.
Okay, so like which agencies are we talking about?
So it's going to include the Office of the Assistant Secretary for Health, OAH,
Okay.
the Health Resources and Services Administration, HRSA,
Right.
the Substance Abuse and Mental Health Services Administration, SAMHSA,
Uh-huh.
the Agency for Toxic Substances and Disease Registry, ATSDR, and the National Institute for Occupational Safety and Health in AGIS.
So that's like a huge chunk of HHS.
Yeah, it's a lot.
And why are they combining all these different things?
So they're saying it's about improving coordination, especially for low-income Americans.
All right.
They want to make sure that people have access to the services they need.
Yeah.
Things like primary care, maternal and child health, mental health, environmental health,
Right.
HIV/AIDS prevention and treatment, workforce development.
Okay, so they're saying that by combining these agencies, it'll make it easier for people to get the services they need.
Right. And, Secretary Kennedy has talked about, getting rid of the alphabet soup of agencies.
Yeah, it's a lot of acronyms.
Yeah, exactly. And so they're trying to simplify things. And, they say that by bringing SAMHSA into the AHA, for example, it's going to help break down what they see as like artificial divisions between similar programs
Right.
and hopefully boost efficiency.
Okay, so more integrated approach to these really important areas of public health.
Yeah, exactly.
Okay, so what other big changes are happening?
So another one is they're strengthening the CDC.
Okay, how are they doing that?
So they're moving the Administration for Strategic Preparedness and Response, ASPR, which handles disaster and public health emergency response, under the CDC.
Okay, so that makes sense, given the CDC's role in protecting public health.
Yeah, exactly. And around 1,000 ASPR employees are going to be moving over to the CDC.
Wow.
Yeah. And they're also creating this new position called Assistant Secretary for Enforcement.
What's that about, like enforcing what?
So this person is going to oversee the Departmental Appeals Board, DAB, the Office of Medicare Hearings and Appeals, OMHA, and the Office for Civil Rights, OCR.
Okay.
And their job is basically to crack down on waste, fraud, and abuse in federal health programs.
Oh, so like making sure that the money is being spent properly.
Exactly, yeah.
Okay, that's good.
Yeah, I think a lot of people are happy about that.
Right. And then what about like the research and policy side of things?
Yeah, so they're also reorganizing that. So the Assistant Secretary for Planning and Evaluation, ASPE, is merging with the Agency for Healthcare Research and Quality, AHRQ,
Okay.
to create this new office called the Office of Strategy.
Office of Strategy.
Yeah, and the idea is to better connect research findings with the Secretary's policy decisions.
So like making sure that the research is actually informing policy.
Exactly.
Yeah, that makes sense.
Yeah, and the goal is to improve the effectiveness of federal health programs.
Yeah, okay.
And then the Administration for Community Living, ACL, which supports older adults and people with disabilities, is being reorganized.
Oh, okay.
So their programs are going to be integrated into other HHS agencies like ACF, ASPE, and CMS.
Okay.
And HHS has said that this won't affect Medicare and Medicaid services directly.
Okay, good.
Yeah, so that's important.
Yeah, and we also heard that they're reducing the number of regional offices.
Yeah, that's right. They're going from 10 down to 5.
Okay, so like less regional offices, more centralized control.
Exactly.
Yeah.
It's all about streamlining.
Okay, so we talked about this huge workforce reduction. Yeah. At the beginning, like, can you break that down for us? Like, where are these jobs being cut?
Yeah, so overall, we're talking about a reduction of around 10,000 full-time employees.
Right.
And we know that HHS sent a formal RIF notice to union leaders at the American Federation of Government Employees, AFGE.
Okay, what's a RIF notice?
It's basically a layoff notification.
Oh, okay.
And this notice said that between 8,000 and 10,000 employees could be laid off,
Wow.
with a potential effective date as early as May 27th.
So soon.
Yeah, and they said that employees could start getting notices as soon as March 28th.
That's like really fast.
Yeah, it's a really tight timeline.
Yeah. So which agencies are facing the biggest cuts?
Well, the FDA is facing a big one. They're losing about 3,500 employees.
Oh, wow.
Yeah, and HHS has said that this won't affect the people who review and inspect drugs, medical devices, and food.
Okay, but like how can they lose that many people and not have it affect those things?
Right, well, that's what a lot of people are wondering. And there have been reports that FDA staff were already facing doubled workloads after previous layoffs.
Oh, really?
Yeah, so, there's concern that the agency is already stretched thin.
Right. So like losing that many people is only going to make things worse.
Yeah, potentially.
What about the CDC?
So the CDC is losing about 2,400 employees.
Okay. But
Yeah.
they're also getting those people from ASPR, right?
Right. But even with that transfer, they're still losing a lot of staff.
Yeah.
And then NIH is losing about 1,200 employees.
Okay.
And HHS has said that those cuts are mainly due to the centralization of administrative functions like HRIT, procurement, communications, things like that.
Right. So it's less about the science and more about the back office stuff.
Exactly.
Okay. And then what about CMS?
CMS is losing about 300 employees.
And a former HHS employee told us that these cuts could really impact caseworkers who help people navigate the ACA marketplaces and Medicare Advantage.
Yeah, that's a big concern because those caseworkers provide a really valuable service.
Right. And they also mentioned that it could affect account management teams who work with health insurance plans.
Right. So there's concern that this could lead to a decline in service quality.
Right. So while HHS is saying that most of the cuts are going to be administrative, there are definitely concerns about how this is going to affect the actual services that people rely on.
Right. And they said that they're going to target administrative positions in areas like HR, IT, procurement, and finance.
Right.
And roles in high-cost regions and positions that are redundant.
Right.
but, the devil's in the details. Like, how are they actually going to implement these cuts?
Right, and how is it going to affect the day-to-day operations of these agencies?
Exactly, and that's what a lot of experts are worried about.
Yeah, I mean, it's not surprising that all of these changes are causing a lot of anxiety among public health experts and employee unions.
Definitely.
So, what are some of the main concerns that you're hearing?
So one of the biggest concerns is whether HHS will be able to maintain service levels with a smaller workforce.
Right, because they're doing more with less.
Right.
Right?
Exactly. And this is especially concerning because they're also cutting a lot of federal grants that were put in place during the pandemic.
Oh, right. So state and local health departments are losing funding at the same time that they're facing potential staff shortages.
Exactly.
Yeah.
It's double whammy.
Yeah, that's tough.
Yeah, and some people are describing it as like uncertainty and chaos.
Yeah, that makes sense.
It's a lot of change all at once.
Yeah.
And Dr. Georges Benjamin, who heads the APHA, he's predicting that American life expectancy is going to worsen because of this.
Wow.
Yeah, he's pretty concerned.
Yeah, I mean, that's a pretty dire prediction.
It is, yeah.
So what are other experts saying?
Well, Brian Castrucci at the de Beaumont Foundation, he's asking who's going to be left to lead the effort to make America healthy again, with all these cuts. And Larry Levitt from KFF, he's pointed out that these workforce reductions could actually lead to more wasteful spending down the road.
Oh, how's that?
Well, he's saying that, if you cut too much, you might end up undermining initiatives that are actually saving money in the long run.
Right. So trying to save money now could actually cost more money later.
Exactly.
Yeah. Okay.
And Dr. Stella Dantis from ACOG, she called the cuts alarming. And she warned of reverberating damage throughout the U.S. health system.
Wow. So a lot of people are not happy about this.
Yeah, there's a lot of concern.
And what about the unions? What are they saying?
So the NTEU, they called the plan disastrous. And they said they're going to fight it.
Wow.
Yeah, they're really worried about the impact on local health programs.
Right.
And they're saying that these cuts are going to endanger public health.
So a lot of pushback.
Yeah, a lot of pushback.
So what's HHS saying about all this? What's their response?
Well, Secretary Kennedy has acknowledged that this is going to be a painful period for the agency and its employees. Right. But he's saying that it's necessary to make these changes in order to achieve greater efficiency.
Right.
And he's emphasizing the new mission of reversing the chronic disease epidemic.
Right. And what about people who are worried about losing their health insurance or their access to essential services?
Yeah. So he said that Medicare, Medicaid, and other essential health services are going to remain intact.
Okay.
And he said that no American is going to be left behind.
Okay, so he's trying to reassure people that these changes aren't going to hurt them.
Exactly, yeah.
Okay, so big picture, what are the key takeaways from all of this?
So basically, HHS is undergoing a massive transformation.
Right.
They're cutting their workforce by a lot.
Right, 20,000 people.
Yeah, when you include voluntary departures and probationary employees.
Right.
And they're reorganizing the agency to make it more efficient and to save money.
Right. And to focus on chronic diseases.
Exactly, yeah.
And this is not just a minor tweak.
No, it's a fundamental shift in how HHS operates.
Right.
And what its priorities are.
Yeah. And a lot of people are really worried about it.
Yeah. I mean, public health experts and employee unions are raising concerns about the impact on service quality and accessibility.
Right.
And they're worried that these cuts could actually end up costing more money in the long run.
Right. So it's a trade-off.
Exactly, yeah.
So what does all this mean for the future of public health in America?
That's the big question.
Yeah, with a smaller HHS and a new focus, what's going to happen?
Yeah, and, how are they going to address chronic diseases and emerging infectious diseases with fewer resources?
Right. And, we've got to think about the balance between efficiency and the ability to actually deliver essential health services.
Absolutely. Yeah, that's a key point.
So hopefully this deep dive has given you a better understanding of this really complex issue.
Yeah, hopefully.
And, it's a developing story, so keep following it.
Yeah, it's definitely.
And think about what this means for you and your health.
Yeah, it's important.
Yeah. All right. Thanks for joining us.
Thanks for having me.
All right. And we'll see you next time. See you later.